So it's been 3 months since that we have been working on each other for your foot pains and your knee pains and all the pain that was shooting down. So give me an update, please.
Well, first of all, I think using the insole really helped me maintain and stabilize my foot, and obviously to work its way up as it is the foundation.
Okay.
To work its way up from ankle, knees, all the way up to my hips, and obviously the rest of the spine all the way to my neck. So I think that was a good first step.
Okay.
You know, pun intended.
How about tell me about the numbness and tingling you've been experiencing on your fourth and fifth toes previously?
So that's gone completely.
When was it gone?
I think maybe month and a half in.
Okay.
So that's gone. The knee pain is practically disappeared.
Okay.
And then after that, I feel like I can definitely. I feel more stable. So what really helps is when I go to the gym now, and if I'm going to do a squat, which I couldn't do before, you know, with heavy weights on my shoulder, I'm actually able to do it.
Good.
Up, down, and back up again without any knee pain, ankle pain, or lower back.
So you did have. So let's discuss about the low back pain before and after. Like you and I have saying to each other for the past 2.5 months or so that your knee pains and your foot pains were kind of originating a lot from your low back area. So let's talk about what it was before and then what about now.
So the improvement is I would say at least 95% improved.
Wow, that's good.
You know, that's pretty much what it feels like. Mainly is because first of all, I know it's healing, but secondly, because I know we're able to follow up on a regular basis, it also gave me confidence.
Okay.
So the confidence also works in together with the body. And so again, going to the gym, I did biking.
Good.
I did a long bike ride, so that was also really helpful as far as maintaining the proper balance and you know, strength together with just the proper balance of the body. It makes a big difference.
One last question I wanted to ask. So I know that you do a lot of recreational biking.
Yes.
And then you also had a lot of numbness in going to your tailbone area as you were riding a bike for a long time. I cannot ride bike for like 20, 30 miles, but I can only imagine what that actually feels like on your tailbone area or your buttock area. And you told me that kind of gives you numbness. I know you still bike. Mm-hmm. So what's the difference now?
The last bike ride I did was 100 miles.
Wow.
I did not feel anything until at least I was 60 or 70 miles in.
So that's good.
It's really good, but that's because also I was pushing myself a lot more than I normally do. So I think it's also a combination of things. But if I do 30, 40 mile ride, there's no numbness.
Gotcha.
Yeah.
So one of the first things that we actually did when we met each other was that we look at your toes and we check the nerve strength that coming from your low back area down to your knees to down to your foot. And then we check the strength of the individual toes to see what the strengths are like so that we can check the functionality of each nerve. And we also, you know, examine your foot this way and then find if there's a numbness or weakness. And then last time when we talked, we actually had a numbness right here and right here. Is that correct?
Yep.
And also weaknesses on this areas too, right?
Correct.
So let's go ahead and check afterwards. Go ahead and push down. That's pretty strong.
Yeah.
Down. Right here, third one. Good. This one was the weak one, so let's go ahead and do it. Good. That's pretty strong. Mm-hmm. Actually, left side is stronger than the right side now.
Yes, it feels that way.
Push down. Do you have any numbness here right now when you do this here like this? Zero.
Yeah.
That's good.
It's been the stabilization of the lower back that was the key element for me. It created such a like a harmonious balance in my body. It makes a huge difference.
Good.
Huge difference. So, and this started not just after 2.5 months. It started after about a month.
Good.
That we did the sessions.
Okay.
And so it's really good stuff.